Hey everyone, welcome to level 2. I'm sure you guys are really happy and it's just a matter of time when you'll be done with level 1, 2, 3, 4 and finally you'll have RN degree. I just got done with my license exam and I got one of these and I'm sure you guys will be able to get it soon as well. Now before we start today's video, let's just talk about what's our game plan is going to be. So I'm going to make this video and it's going to be the 15-week series over which in that what I'm going to do is I'm going to have week 1 and in week 1 I'll cover all the content which we need to know for week 1 as well as practice the question for school as well as for the NCLEX. So we'll have an idea of how different type of question it could be in the different scenarios, and we'll do that for every single thing in level 2 Med-Surg 2. So without any further delay, let's just get into the content which we have in week 1. Okay, so the first chapter which we have in week 1 is chronic illness and older adult. In the chronic illness and older adult, we'll talk about what acute versus chronic is. Then we'll talk about prevention of chronic illness, which we'll talk about the primary, secondary, and tertiary. Then we'll talk about the ADLs versus IADLs. Then we'll talk about the ageism. Then we'll talk about biological aging theory and what frail older adults means. Then we'll talk briefly about the elder mistreatment. Then Medicare versus Medicaid. And lastly, we'll talk about the drug. That should say drug. That's my bad. Drug, metabolism, and ageism. And finally, we'll practice some of the NCLEX plus exam 1 type question. Okay, so without any delay, let's get started. So acute versus chronic is super simple. When we say acute, it means that it's something that is sudden, less than 3 months. When we say chronic, then it means that it's happening over the period of the time, which is more than 3 months. Now, when we say acute, what are the things we should be mindful of? These are the rapid onset with a short duration. Whereas with the chronic, these are prolonged, there are no cure, they are irreversible changes. Chronic, over the period of time, overlapping declines in the baseline, and that's what we have for the acute versus chronic. Then we'll talk about the prevention of chronic illness, which we have primary, secondary, and tertiary. This is really important topic for the exam as well as for the NCLEX point of view. So when you talk about the primary, secondary, and tertiary, we said primary. In the primary and the secondary, we are preventing from happening. So we are preventing any kind of disease or disorder from happening. But with the tertiary, you already have that disease or disorder, and all you want to do is now prevent it from getting further worse. So let's dive into this. So we have the primary, which means the prevention from getting the illness in the first place. So you don't want to get the illness in the first place, and these includes educating the patient about the diet, exercise, immunization, and those kind of things. With the secondary, all you're doing is you're doing the early detection as well as the screening. For example, mammogram, colonoscopies, prostate exam, and those kind of things. And the third one we have is the tertiary. In the tertiary, we have the disease now, and what we're doing is we're trying to prevent it from getting further worse. And patient will have the period of exacerbation, and we'll try to make them as stable as possible. These include rehabilitation, limit the progression of disease, and those kind of things. And that's what we have in the prevention of chronic illness. Then we'll talk about the ADLs versus IADLs. One of the easy way to remember what ADLs versus IADLs is think of ADLs with the mnemonics death, DEATH, whereas in the IADLs, think of this as the mnemonics facts, FACTS. What does that mean? So when we say ADH, it means that may not be safe at home by themselves if they are not capable of performing certain things. And what are the things? That's the death. Dressing, eating, ambulating, toileting, and hygiene. Mnemonics, death. So these are the things which if they are not capable of performing, they might be at the risk if they are at home by themselves. Whereas when we say, one more thing about the ADLs, ADL stands for activity of daily living. Whereas IADL stands for instrumental activities of daily living. IADLs means still safe at home by themselves but may need assistance or some task if they are not capable of performing. So some kind of assistance is needed with the instrumental ADLs. For example, it includes food preparation, accounting, cleaning, transporting, and shopping. which is given by the mnemonics FACTS. FACTS. Okay, and that's what we have in the ADLs versus IADLs. The other topic we have, and this is again really important, is ageism. Ageism in simple term means the negative attitude towards older people. So for example, if someone is driving slow, we get this mindset, oh, this person must be the old lady who's driving really slow. So the negative attitude which we have towards someone based on their age is called ageism. So, and we have defined this as negative attitude leading to the discrimination and disparities in the care. So when we say disparities in the care, what we mean is, like, let's say that we're gonna give the instruction about any kind of procedure. For example, let's say the cardioversion, we will not try our best to give them the instruction because we'll be like, we'll have this mindset that, oh, this patient is old and therefore they will not be able to understand the procedure. No, we are not supposed to do that. We need to tell them exactly what kind of procedure they're going to have, and things which we can do to make sure that they understand properly includes saying things nicely, using the pamphlet posture, and those kind of things. So that's what ageism means. So in simple term, I have this over here: don't base the care based on someone's age. Smiley face. Okay, now we'll talk about the biological aging theory, which is kind of this could be a little bit confusing, but this is what we have divided. So when we talk about the biological aging theory, there is a balance, which we have divided into two categories. One, this theory believe about the damage or error theory, as well as genetic or programmed. So biological aging theory, with that, we believe that aging is the part of life and it is genetically programmed. So we are genetically programmed to become old. There are some of the things which we can do to reduce the period of aging, which includes our exercise, good nutrition, social support, stress management, coping abilities, or coping resources. Those are the things which will reduce the aging process. That's the genetic programmed theory. On the other hand, there are some of the things which is explained by the damage or error theory, which says that if we have stress, cancer, cardiovascular disease, diabetes, or obesity, those are the things that will elevate or increase the process of aging. That's how we have divided the biological aging theory into two different categories of how it will affect the aging. Aging is inevitable. It's just a matter of fact what are the things that can cause it to become faster, whereas there are some of the things that can make it slower. That's what we have with the aging theory. Now we'll talk about frail older adults, which in simple term, when we say frail older adults, all we're saying is it's kind of like a multi-body system failure where we're having the functional decline of the ability of a body. So if someone is in order to classify someone as frail older adult, we need to have 3 or more of the following 5s. Number 1, unintentional weight loss. If a patient is losing the weight unintentionally, the patient could be in the category of the frail older adults. Self-reported exertion, weakness, slow walking speed, and low level of physical activity. So if you have either 3 of them or 3 or more of them, then you could be classified as the frail older adult. Now, the other topic we have is the elder mistreatment. So when we say elder mistreatment, it covers a broad category, but we will briefly talk about some of the important things on that today, in which the most frequent elder mistreatment is neglect. Neglect could be physical or it could be emotional. In simple terms, what we're saying with the neglect is we're neglecting to meet the need and demand of the older adults. That's our elder mistreatment, the neglect, things such as lack of safety aids, proper aids, food, lack of interaction, and so on. So neglect could be by someone else or it could be by self itself. So if there's an older adult who is refusing everything, all the care, all the medicine, all the equipments that they need to have a good lifestyle, then that's the neglect by self. But it could be caused by someone else's as well, where we are over giving medications or depriving them with the necessary medications and those kind of things. So let's talk about some of the signs and symptoms. We already talked about the over and under medication. It also could indicate the dehydration or poor nutritional status. It means that we're not, or the caretaker is not meeting the demand of the older adult's body. It could include the pressure injury, infection, poor hygiene, withdrawal, unexplained fracture, bruising, or burns. Those could indicate the elder mistreatment as well. Those are more like the physical mistreatment, but in general, that's what we have in the elder mistreatment. Then we have Medicare versus Medicaid. When we say Medicare, those are nationally. These are federally funded, where anyone over the age of 65 can get it, unless if they have disabilities or they are at the end-stage renal failure condition where they are needing the dialysis. That's your Medicare. In simple term, federally funded, anyone over the age of 65. Exception includes two of them, disabilities or dialysis. Double D. Then we have Medicaid, which is the state-based and a little bit more complicated. These are based on your income. So you'll get, the program is based on the income. So if you have the low income, you might get the more benefit. If you have the higher income, then you might get the lower benefit out of that. And these cover the long-term care in the US, and that is again based on the income. And lastly, we have the drug metabolism and aging. In that, we'll talk about how the drug metabolism and its effects decreases or increases with aging. As we age, our liver shrink and the amount of blood that goes to the liver decreases as well. And we have lots of drugs that get metabolized by the liver. So if our liver is not getting good blood flow and is shrinking, then it will not be able to metabolize all those drugs effectively immediately, which means that we have the concentration of drug in the body for the extended period of time. That's number one. Number two, we have the GI system that slows down. If our GI system slows down, then we have the decreased absorption of those medication. Again, as a result, it will take a long period of the time for all of the drugs to get absorbed in the body and have effect. So the effect of the drug gets lowered down. Number three, renal blood flows decreases, and if the kidney is not getting the good blood flow, then it will not be able to excrete all of the drug particles on time, again leading us to have increased concentration in the body. And lastly, the total body water decreases, which increases the concentration of the drug, because we have the concentration of water lower as compared to the drugs in the older adults. And that's pretty much everything we need to know in this chapter 1 of week 1. Now let's practice some of the question from this chapter. So for sure you'll have a question about the primary, secondary, and tertiary, and method of prevention, and how to select and differentiate those three categories. But before we go any further, so we have question number 1, where we have a patient with the diabetes mellitus attend a diabetic foot care clinic to prevent the ulcer and amputation. This activity is an example of what? Primary, secondary, tertiary risk reduction. I'll give you a sec to select your answer. Okay, so now the answer for this question, as you have guessed, is tertiary. Now, why is it tertiary? So we said in the tertiary, you have already the disease, which in this case is the diabetes mellitus. You already have the disease. What we are trying to do is we are trying to prevent the complication to get further worse. So the tertiary prevention focus on managing the existing disease to prevent the complication or further worsening, such as in this case preventing the diabetic foot ulcers in patient with the diabetic. And that's one of the ways the question could be written. Let's try one more question. A nurse is working in the clinic that offers free mammogram to women over the age of 40. The activity represents which level of prevention? Primary, secondary, tertiary, or quaternary? Now, for this question, the answer would be, as you have guessed, is secondary. So, good job if you have selected this one. So, what is secondary again? Secondary focus on the early detection and the treatment of disease with the help of screening. For example, screening of the breast cancer through the mammograph in this case. So, the answer will be the secondary. Let's try one more question and then we'll try something else. A nurse is conducting a community health seminar on strategies to prevent the cardiovascular disease. Which intervention described by the nurse reflect the primary prevention? So when we talk about the primary prevention, which of the following do you think will be a primary prevention? So I'll give you a minute. Let's look into that. Okay, so the answer to this question is option C. Why? We have option A, performing the routine blood pressure screening. When we have the word screening, that's the secondary. Option B, administering a medication to lower the high cholesterol. That's your tertiary. You already have a problem and now you're trying to do something to reduce it from getting further worse. Option D, teaching a cardiac rehabilitation class to patient recovering from the MI. So you already have a problem and now you are doing things to reduce it from further happening. And that's your tertiary again. So the answer to this question is option C, providing a smoking cessation education to a group of teenagers. So we are educating them from having a problem. So we are trying to fix it before it even happens in the first place. And those are the different categories of the question you could be expected to know from the primary, secondary, and tertiary. Now let's practice another type of question, which would be ageism question. Now, in this one, you could be expected to know two different kind of questions, where it could be straightforward, that this is ageism, or it could be a little bit tricky, and we'll try to see if we can practice both of the questions. So, as I was talking about, you could be expected to have a question where it could be the straightforward option about the ageism, or it could be a little bit tricky. Let's practice both of these questions. We have a nurse who overhears a colleague saying older adults are always confused and move too slowly to understand the instruction. Which action by the nurse reflect appropriate professional behavior? Now, this question is straightforward. If you look at all the options, A, B, C, and D, I'll give you a sec to pick up. Okay? So, in this one, our answer would be option C. We want to address the colleague privately and educate them about the ageism. So it could be as simple as this one, or you can have a question which says an elder patient is admitted for surgery. The nurse observes that the healthcare team is making fewer effort to explain the procedure, assuming that the patient will not understand. What is the best response by the nurse? So what the nurse over here, the healthcare team, is doing is they are not giving their best to explain the procedure because of the age. So we can see that there's a reflection of ageism. So in this case, what will be the best response as a nurse? We'll say, can you please slow down and provide a clear explanation for the patient's benefit? What we are doing is we are advocating for the patient to ensure that they receive a clear and respectful communication and counteracting anything against the ageism. It also supports the autonomy and provide the informed decision to the patient, which is needed. Now, you could be also expected to know the questions about the elder mistreatment type question, and these are the type of the questions you could be expected to know, where it could be really easy. So with the elder mistreatment, let's practice one of the question. A nurse is assessing an 82-year-old patient who lives with the adult son. The patient have multiple bruises in various stages of healing and appears withdrawn. When the son is present, what is the nurse priority action? So what's your first action as the nurse? You can clearly see that there is the bruises that is in the multiple stages of healing. If it is in the same stage, then we could be thinking, oh, the patient is old, they might fail. But if it is in multiple stages, then there is clearly an abuse. Number one, and number two, the patient appears to be withdrawn, so they're also getting the abuse from it because they are not getting the medication they needed. So for this one, our priority task will be to report the suspected abuse to the appropriate authorities, and those could be the questions you'll be expected to know from that kind of that topic. Now, lastly, you'll have Medicare versus Medicaid, in which we'll talk about what Medicare is versus what Medicaid is. Let's talk about one of the questions. A nurse is explaining the difference between the Medicare and Medicaid to a patient. Which statement made by the nurse is correct? So in this type of question, what you will be expected to know is find the difference between Medicare and Medicaid. And the correct answer to this question is, good job if you got C. So Medicare provides the healthcare coverage for people who are over 65 or those with a certain disability, whereas Medicaid assists the low-income individual and family. Another difference is Medicare is state-based, Medicaid is Medicare is federally funded and Medicaid is your state-based. In the Medicare, anyone with the age of 65 or older, or they have the disabilities such as, or have the end-stage renal failure such as dialysis, they will get the Medicare. Versus Medicaid, if you are low-income family, and these are based on the state. So if you are a low-income family, you'll get it, irrespective of what you have. Okay, and that was the two major difference between Medicare versus Medicaid. And that's pretty much all you need to know in the first chapter of week 1. We have another chapter which is super simple. It will take less than 10 minutes. So we'll catch you that in the other video. Thank you so much.